Hello everyone, welcome to Apollo 24/7's YouTube channel. Today we are in Apollo Hospitals, Kolkata in conversation with Dr. Saibal Moitra, who will talk about allergies.
Allergic diseases constitutes around 30% of the patients in India. Diseases are increasing not only in our country but also worldwide. We have been seeing the prevalence is rising every year, and it encompasses all the age groups, children, adults almost equally, so the rise is more pronounced in children. The various diseases that we find is allergic rhinitis, allergic asthma, atopic dermatitis, the food allergies, the drug allergies, the insect bite allergies, and the serious illnesses like the anaphylaxis, angioedema, like this. Usually these are caused by some trigger factors in the environment. The multiple triggering agents, which might be an house dust mite or any pet dander or the pollen grains or the spores of the fungus, or it could be like some food items. Mostly we see that could be a shellfish like prawns, like lobsters, crabs, or maybe some fish items, the cow milk, the egg, then the soya products. These are the food items commonly we see. Though in our country there is an increase in the sesame-induced food allergy, which we have been seeing lately in various patients and in various age groups. Apart from that, it could be caused by numerous medicines. In fact, any medicines can cause allergic reactions. It could be very severe, and it could entail the patient landing up in the emergency department with shortness of breath. And these medicines mostly are the pain relief medications and the antibiotics and various other medications which are being used during the anesthesia. Apart from that, various insect, which is by-stinging insect allergies, are quite common, like the bees, like the wasps, even the mosquitoes, and these allergies are also quite prevalent in various communities and in various geographical locales in our country. Mostly the manifestations of various allergic diseases, it could be like cough, wheezing, shortness of breath, it could be an itchy rash all over the body, or it could be nasal symptoms like runny nose, sneezing, blocked nose, headache, redness of the eyes, watering of the eyes. There could be GI symptoms, which includes like abdominal pain, vomiting, diarrhea, cramps, and apart from that there can be hoarseness of voice, and in very severe cases choking sensation, loss of consciousness, and also fall in the blood pressure. Mostly there are very good treatment available for the allergic diseases, but it requires very early and specific diagnosis and prompt initiation of the treatment, and for this specific evaluation by the allergy specialist or the physician who is in charge of the treating the patient is to be evaluated. The allergenicity or triggering factors need to be found out. Patients are then advised to avoid those items, and then they are put on the therapy, which includes the medicines. It also includes the avoidance measures, and third thing, the allergen immunotherapy. Allergen immunotherapy is a specialized treatment protocol for the allergy patients. It is done only in selected patients with very selected allergens. These are long-term treatments. It includes the sublingual tablets or some injections which has to be taken. This is the only disease-modifying treatment available for the allergic patients, and which actually helps in controlling the allergic signs, symptoms, and prevents the progression of the disease into serious forms. So by all these measures, an adequate awareness is needed so patient understands they can reach the department, they can reach the doctor early, which will definitely help in reducing the morbidity and also the suffering caused by this disease, and also goes a long way in reducing the death because of the serious allergic diseases. Usually we get to see that the patients coming to us with a big list of the food items that they have been advised to avoid after getting an allergy test done. We usually do either from blood or on skin, and the patients often remain confused with that they don't know what to do. The thing is that in the allergist practice, first of all, the doctor has to sit with the patient. From the patient's history and the clinical signs and symptoms, we decide about which are the items which is needed to be tested for, because which are present in the patient's environment or the patient's food intake or the diet. So then we come down to only 10 or 12 items which the patient needs to be tested. And after it has been tested, it is not that the patient needs to avoid all the positive items. We actually again sit with the patient, which is called a second consultation or a second history taking, and we take each of the individual positive items and then we actually compare it with the history and the other findings in the patient, and then we come to understand that maybe out of maybe 10 or 12 positive items, only maybe 1 or 2 or at times maybe none of these positive items is actually causing the symptom in that particular patient with a particular disease problem. So that means the patient need not avoid all the food items, which is not the right thing to do. It causes unnecessary change in the dietary habits, may cause the nutritional deficiencies, vitamin mineral deficiencies, and which can lead on to other problems. This is a very important aspect to understand, that allergy test only shows presence of an antibody in the blood or on the skin, that is the IgE. Mere presence of the IgE does not show that you are allergic. It only shows that you have the chance to develop allergy from that item. You may develop allergy from that item, you may not. So that has to be correlated with the history, and then we come down to the actual diagnosis of the triggering factor from the environment. Usually the patients come to us with the problems which can be like from rhinitis problem, that is the patient having runny nose, blocked nose, sneezing very regularly. Usually these symptoms are pretty common because these are all the defense mechanisms of the system of our body. If a patient is having say runny nose or blocked nose or sneezing, or maybe quite rarely to some irritant, maybe exposed to dust or dusting, it is a very common symptom for the patient. But when this symptom is occurring regularly and it is hampering the patient's quality of life, or maybe the patient's sleep and maybe the patient's daily activities, so that is the time when the patient needs to actually seek the advice of a specialist, that's an allergy specialist. There are some warning signs. Warning signs and symptoms include if there is a headache associated with this, if there is a blocked nose, or if there is a patient is getting this watering of the eyes quite repeatedly and patient has to mouth breathe. These are the warning signs when the patient needs to seek the advice early. Apart from that, patient might be, if the patient gets some history like says the patient is having a shortness of breath with that, patient is having a wheezing sound coming from the chest, or the chest tightness, or maybe the cough which is occurring quite regularly at night or maybe early in the morning. This same sign symptom shows that the patient is having actually lung involvement from the allergy, which could be an allergic asthma, and patient should definitely seek the advice of the specialist doctor. Similarly, if the patient is having an itchy rash, which is quite common, which can happen to any irritant, it can happen to any as a normal response to any of the irritant which is there in our environment. It could be a clothing, it could be any substance that we have taken, or it could be like paint or any environmental triggering factors could be there. But if there is a swelling which is occurring all over the body, causing intense itching or the pruritus which we call, and which the patient needs to take some medicines, or the patient is not getting relieved by taking some local over-the-counter anti-allergic medications, and it is happening quite regularly, then definitely the patient needs to go to a doctor or the allergy specialist. And along with that swelling, if there is swelling of the lips, if the swelling of the eyes, if there is a choking sensation in the throat, then immediately patient has to rush to an allergy specialist or to emergency department, because these are the warning signs that it is affecting the patient's windpipe, it is affecting the patient's major airway, so that the patient might land up into a laryngeal angioedema, or what we call a voice box gets swollen and the patient might not be able to breathe. So these are the signs and symptoms where the patient needs to rush to a doctor, get properly evaluated, treated, find out the triggering factor, avoid them, take the medications, and if certain patients they are put on the immunotherapy, they should take the immunotherapy, because by this way they will be able to control their allergic disease in a much better way and prevent the allergic disease from progressing. Because what we have in allergic diseases is called allergic march or atopic march. That means the allergic diseases starts with one type, then progresses to the other type. You might start with a food allergy, or an atopic eczema or atopic skin or a skin condition, skin allergy, which might progress to an involvement of the nose, that is rhinitis, or maybe to an asthma, or maybe some other very serious allergic problems like the anaphylaxis or maybe the angioedema. This is what we call this progression of the allergic disease. It happens over a period of years, maybe from very childhood to adulthood, or it may happen over a short period of time also. So this atopic march or this allergic march is an important component of any allergic disease. One has to recognize it, understand it, detect it early, and halt this progression of the allergic disease so that one does not land up in having a serious form of the disease. Usually it starts with very trivial signs symptoms, but over a course of time progresses to a serious disease. So that has to be taken care and properly treated so that they do not land up into very serious or the major complications of the allergic diseases.
For consulting an Apollo expert, download Apollo 24/7 app, and for more such health tips, like, share and subscribe to our channel.